in church twice, I think for 2 consecutive Sundays now. I had my pastor leading a prayer on cholera outbreak in Nigeria. I make sure whatever I'm making use of, I must make sure it's covered.
Personally, I live in a hygienic environment. See, personally, I even as old as I sweep my environment, keep my environment, and encourage people who live very close to me to live in a good environment.
Those are residents of Akure speaking on their awareness of the cholera outbreak ravaging the country. The disease has always been a significant public health threat in many parts of the world, particularly in regions affected by natural disasters and inadequate infrastructure. The numbers of fatalities of the cholera outbreak are increasing daily, and the main cause of the outbreak has been linked to contaminated water and poor sanitation hygiene, made worse by the rainy season, which can spread the disease through flooding and unsafe water sources. Nigeria is currently experiencing cholera outbreak and ranks number 1 globally among countries with the highest number of people defecating in open places. How key is a clean environment to containing the spread of the disease? The Director for Disease Control and Immunization, Ondo State Primary Healthcare Development Agency, Dr. Victor Akinpelumi, signposts the essence of good personal hygiene and sanitation practices.
Cholera as a disease is a disease of dirty environment, and it's being caused by eating a contaminated food with virus called Vibrio cholerae, and it's not only by food, it's also by water and other juice or fruit. Anything that goes into the mouth that has already been contaminated with this virus will cause the disease cholera. Prevention is usually better than cure, and it's more cost effective than cure. And that is why we advocate that people should take all the preventive measures that are necessary to curb the contact with the disease.
To Dayo Ogedengbe, an environmental officer, residents of a state must prioritize hygienic practices to stay immune from the disease.
We are sensitizing people right from the market, from the streets, to ensure that we live healthy, we live in an healthy environment. Consumption of food should be an healthy consumption. We should consume food that are prepared under strict supervision, and water as well. We move around the house, the streets, the market to ensure that at every point of productions, that whatever we are taking in form of water, in form of food, is healthy.
As of June 25, 2024, the National Center for Disease Control and Prevention (NCDC) has reported over 1,500 suspected cases of cholera and 53 deaths across 31 states in Nigeria since the beginning of the year, with warnings resonating to the general public to embrace all safety tips against the disease. Joy Pius, OSRC News.